Hello everyone and welcome to this morning's presentation. My name is Ashleen and I am a first year nursing student from Notre Dame University. Today my fellow students and I are here to talk to you about falls prevention in mature adults. I will present to you why falls are a significant public health concern, why this condition is a problem to mature adults, and I will also discuss what the impact of a fall might look like. What is a fall? Falls are a serious public health concern to mature adults. The World Health Organization defines a fall as an unexpected event that causes an individual to come into contact with the ground or lower level. As a result of such an event happening, the person involved could potentially end up with serious injuries. These could be fatal or non-fatal. Through my research, I have found that accidents due to falls occur more frequently in individuals over the age of 65 and are the primary cause of all accidents in Australia. So why are falls a problem to mature adults? Falls can pose more serious health outcomes. A common accident like a fall can potentially impact or change your life. The things we take for granted every day, like being able to get up and down from our chair or cooking a meal, could potentially become extremely difficult as a result of a fall. Falls put people at risk of more serious injuries leading to disabilities in the future. Accidents due to falls in older adults tend to pose more serious health outcomes. As we approach middle age, our bones start to get weaker. This increases the risk of broken bones and fractures from accidents that may occur. As a result, broken bones and fractures can take a longer time to heal. Research shows that this may increase the risk of developing osteoarthritis in the future. There are also psychological factors associated with a fall. Falls can cause psychological trauma in mature adults. Recurrent falls can cause fear of falling again. This can result in an individual becoming isolated due to fear of leaving their homes. Mature adults that have recurrent falls lose confidence in their ability to move freely without an accident. Therefore, they tend to avoid activities and socializing. This can cause a person to feel isolated from the rest of the world. Isolation tends to make aged people lose their connection in society. This can have its own negative health outcomes. Reports indicate people with no social connection tend to have anxiety and depression. Presentations of a fall include broken bones, bruises, sprains, swelling, cuts, and head injuries. Hip fractures and brain injury are the most common outcomes of falls in your age group. What impact do falls have to patients? 1 in 4 mature individuals have a fall each year in Australia. 30% of mature adults who fall will have recurring accidents. Research shows that current falls increase the risk of disease and death rates. 43% of injuries require hospitalization and 42% cause death. This is a concerning number expressed by the Australian Institute of Health and Welfare. Why are falls a problem to your age group? Well, research indicates that some patients tend to be too scared to follow rehabilitation protocols. This can prevent an individual from functioning normal again. This can be a problem as you could end up having a reduced quality of life. as falls can lead to more serious injuries, which could potentially lead to disability in the future. When mature adults cannot care for themselves, they could potentially end up residing in a nursing care facility. It is evident that through my research, falls are a concern in your age group, and raising awareness on this topic is important for your well-being. I am now going to get my fellow nursing students to introduce themselves and provide you with their research on falls. If there are any questions, I am more than happy to answer at the end. Thank you, everyone.
So there are three main factors that come into play when considering what causes falls as a condition. So intrinsic factors such as age, chronic health conditions, visual and cognitive impairments, or medication. Extrinsic factors, which are not within the person, so their environment or things they wear, such as poor illumination, slippery or uneven surfaces, inappropriate footwear, and dangers in their home. And behavioural factors, including risky behaviours and physical activity levels. So, for intrinsic factors, age-related physical changes relate to people who are older, as they tend to have weaker bones, slower muscles, and worse balance and stride, all of which raise the rise of falling. Chronic health conditions may affect strength, balance, coordination. This can be affected by conditions including arthritis, cardiovascular illness, and neurological disorders like multiple sclerosis and Parkinson's disease. Visual impairments, these are usually age-related changes which reduce the efficiency in eyesight, such as glaucoma and cataracts. They have an impact on the ability to recognize hazards and perceptive depth. Cognitive impairments are affected by diseases like dementia and Alzheimer's, which can cause memory problems and poor judgment, which raises the chance of falling. A number of medications, such as antidepressants, sedatives, and antihypertensives, have adverse effects that include low blood pressure, lightheadedness, and cognitive impairment, which can result in falls. So, in extrinsic factors, such as poor illumination, increases the falls risk, as older people may find it challenging to properly navigate their surroundings if there is insufficient illumination. Slippery or uneven surfaces consist of uneven pavement, loose rugs, and wet flooring, which they could trip on or slip and fall. So, inappropriate footwear includes shoes with insufficient grip and support, which can make it more slippery and likely to fall. Dangers in the home include jumbled or badly arranged furniture, high steps, and the lack of handrails in key locations. And behavioural factors such as risky behaviours, such as a person not willing to use a walker even though they need it, or overestimating one's physical ability, can lead to falls. Physical activity levels by not exercising can weaken muscles and diminish bone strength, increasing the vulnerability to falls. Preventative strategies when managing falls risk patients include exercise programs, home modifications, routine eye and health examinations, and educational programs. So, exercise programs such as Tai Chi and yoga are examples of exercises that emphasize strength, flexibility, and balance. So, it gives them more confidence and skill in maybe making their stay at home before moving into maybe a nursing home when they need assistance. So this can help them stay at home longer and keep confidence when living at home and keeping their strength. Home modifications include tripping hazards being removed, grab bars installed, and better lighting, so it decreases their risk of falling in their home and have assistance when moving around home. Routine eye and health examinations are there to keep an eye on medical issues and make necessary medication adjustments. So just say they're on a sedative medication that makes them drowsy, they can make adjustments so that they are at less of a risk fall when at home alone, so that can be monitored. And educational programs are essential in preventing falls risk by educating senior citizens on the value of safe habits at home so they can feel more confident that they are educated and know how to keep themselves safe at home. When slowing the progression of falls occurring, there's many factors that come into play, such as falls risk assessments, exercise plans, physical rehabilitation, modifications to environments, safe living space design, examining and adjusting medications, and teaching proper usage. So, falls risk assessments should be done frequently to assist in early detection of high risk individuals, enabling prompt intervention, which can prolong and transition into a nursing home where they would need assistance, and so it gives them more confidence to stay at home living by themselves without assistance. Exercise plans have shown that strength and balance training plans work well by providing them with coordination being enhanced with exercises such as Tai Chi or physical therapy. Physical rehabilitation addresses the particular deficits brought on by the fall. Physical therapy can help people who have already fallen recover and avoid falling again. Modifications to the environment may drastically lower the danger of falls by installing grip bars, upgrading lighting, tying down rugs, and making sure the flooring are non-slip. Safe living space designs comes by moving furniture out of the way of traffic areas to make room for walkways and eliminating trip risks. Healthcare providers can examine and adjust medications regularly by checking an elderly person's drug regime, helping reduce side effects like drowsiness or dizziness, which can lead to falls. And teaching proper usage can avoid older people taking the prescriptions incorrectly, which could result in falls by making sure they know how and when to take them.
Hi, my name is Harriet, and I'm also a student nurse at Notre Dame, and it's my absolute pleasure to be speaking with you today. So far we've heard a lot of really interesting information from Ashleen and Emily, but at this stage you might be feeling a bit overwhelmed because we've been giving you lots. But don't worry, we definitely don't expect you to remember everything, and we're coming around now with a handout sheet that you can take home so you can read back over the information in your own time and kind of ponder it, because I know it can be a lot at once. But again, we thank you all for being here today and being motivated about preventing falls, or at least interested. So yeah, as I said, you might be thinking, now what does this all mean for me? And now some of the key takeaways that I'd like to emphasize is that falls are a really significant public health concern, and they're not something that we can kind of just brush off or push aside, because if we're not managing it well, it does become really pervasive over everyday life. And as we know, people over 65, so you guys, are more vulnerable to falling, and we also know that falling has a significant impact on people's physical health as well as their social functioning. So yeah, what we want to stress is that you definitely shouldn't be feeling shame around falls that you've had in the past or the possibility of falling in the future, as it is something that really does affect a lot of people, and it's often something that is luckily not a life sentence, like other illnesses. It's something that if we address the factors and we really get on top of it, you do have the potential to not only avoid falls risks, but also maybe just have a greater general quality of life. Because a great thing about engaging with falls prevention activities is that a lot of them are social, they're exercise programs, they're educational programs like you're at today, where you get to catch up with your friends. or make friends if you don't have friends at current. So yeah, we think it's a really good thing to invest time into, because if you're not only avoiding falls, but you're also just improving your overall well-being, which we think is a great thing at any age. So like I said, the sheets are coming around now, and we will be taking questions in a minute, but yeah, thank you. So throughout this presentation, there is the possibility, and we hope that this happened, that some light bulbs went off and you guys started thinking about, oh, I actually haven't got my eyes checked in a while, or oh, actually, I've been meaning to clear out and declutter my living room so it's not as busy. And so they're really valuable things, and they're things that you can kind of implement in your own time. But when it comes to looking for other resources beyond that, two we really endorse are the Strength for Life Claremont program, because it's a structured program specialized in the area. And it is for over 50s, so it's really accessible for and catered towards you guys, which is great. And yeah, it's a good social activity, and it contains a few components. So there's obviously the active component, but there's also an educational component, and it's got really nice values underpinning it. It's all about living longer and living stronger, as the name kind of implies. So that is one that we get really good feedback about. And then the others is just the Falls Prevention Clinic, which is a good resource where you can find out individualized information about falls prevention. And if you ring them up, they do have seasonal kind of classes, and they will be able to orientate you to current offerings that they have that would maybe be valuable or interesting to you. So they do run classes, but yeah, they again also do it just a lot of education for people. So those are some great resources, but we'll be hanging around for a bit. Like we said, we are handing out the resource, so you can have a look at that in your own time. But we just want to give you a big thanks for being here, being motivated to learn. And yeah, it was our pleasure to speak on this topic. And we wish you all good health and a fall-free future. Thank you so much. Bye.